So first of all, we're going to talk a little bit about how we got here. So for me, my story is I have just over the last year, honestly, I have had the worst gut issues that I've ever had. And we'll talk about some of them. And so some of the things that you're going to hear tonight are some of the things that I've done to help heal my gut. So, Christal, do you want to talk a little bit about what brought you here?
Sure. Yeah. So I'm a naturopathic doctor, and I came to be a naturopathic doctor because of all of my health ailments from when I was really young. So people have heard my story before. Have heard me talk about arthritis, and I was in debilitating pain when I was 12 years old, and just off and on all of these really hard arthritic medications. And then obviously that led me to gut issues, which I unknowingly continued to take these medications, which led me to chronic yeast infections and led me to anxiety and bloating and diarrhea and gas and all of these ailments that I was told that I just had to live with it. And there was nothing else I could do except continue these pain medications. And so I eventually was done with my last knee surgery and my chronic yeast infections, and then sought out alternatives. And I found naturopathic medicine, and found throughout my training and throughout my clinical experience that it led me all back to the gut. So I went into thyroid expertise, and then hormones and sports medicine. And it didn't matter what I did, it always led me back to the gut. And then one day I had my son. He's now 6, but at the time he was only 8 months. And I did a coffee enema with my husband just for fun. I didn't even feel like I needed it at that time. And out comes, within 3 days, 7 feet of tapeworm. And at that time, I did not have major gut issues. I had anxiety, I had fatigue, I had depression. And this was the first time in my life that I had these things. And I blamed it on postpartum depression, postpartum anxiety. When I released that tapeworm, that's when within 2 weeks, maybe a week to 2 weeks, I started to feel finally relief with the exhaustion and the pain and everything that I was going through. So that was a big light bulb moment for me of how many people are highly medicated and not brought to the awareness of infections in the gut, because I then did not just have parasites. I then uncovered there were other things like SIBO, small intestinal bacterial overgrowth, and Candida. Our house was infested with mold, which we didn't know at the time. And so it led me to this place of understanding how infections can really hijack our system. So you have a similar story, I think, Chantel, as well, but that's how I got here.
Yeah. Well, we're going to kind of share our screen back and forth, and you'll see that these are some of the gut infection. If you have a gut infection or you have parasites, these are all the different things you could have. I personally have skin issues, like psoriasis and eczema. I've had massive joint pain. I have an autoimmune disease. I have psoriatic arthritis. And so for me, those are kind of the different things, and massive, massive constipation. So what would happen is I'd be so constipated. And then I would be like so constipated that would do something about it. And truthfully, it's literally causing pain, like causing pain on my sides, causing pain kind of where your colon goes around on this side and the stomach. So just really bad. Some people have constipation, some people have diarrhea, some people have constipation and diarrhea.
And I think that's the myth. You assume that because you have constipation, it can't be parasites. We assume parasites equals diarrhea. And it's actually the opposite. The diarrhea comes more in the acute phase. So you might have gotten food poisoning 5 years ago. And then 2 years later, you end up with constipation. That is that parasite or that infection that has found its way into your system and now has created a chronic gut issue. And that has now led to constipation. So there's a lot of myths around parasites.
Yeah, so we're going to start talking about gut infections. I want you to tell people a little bit about SIBO, what it causes, and how many people actually have it.
right? So the amount of people that I see for gut issues are mostly diagnosed with irritable bowel syndrome. So that's IBS. And the doctor will usually come to that diagnosis because you've done the colonoscopy, you've done the stool tests, and they're negative for parasites, you're negative for H. pylori, you're negative on the colon, on the colonoscopy, on the gastroscopy, on the endoscopies, and everything's negative, and your blood tests all come back normal. And so you're left with the diagnosis of exclusion, which is, I don't know what you have, but your gut is irritated. You have symptoms, you're not making it up. So it's an irritated bowel syndrome, irritation, right, in the gut. The problem with that is we don't try to find out the root cause of that. What is irritating my gut? And so SIBO, which stands for small intestinal bacterial overgrowth, has been found to be the leading cause of irritable bowel syndrome. In my opinion, IBS should be completely eliminated, and parasites or SIBO should replace this diagnosis because there's always a cause. So SIBO is, the typical person that has SIBO will have bloat. Bloat happens because these bacteria, which are an overgrowth in your small intestine, which happily reside there in low numbers, because you have good and you have bad bacteria, or we call them opportunistic. They're not bad until they grow into overgrowth. So that's what SIBO is from chronic antibiotics or food poisoning or parasites, something that's occurred that has allowed the opportunistic to grow into amounts that are now causing these symptoms. And what happens is these bacteria will feed on your food. So you're eating food and they ferment on that food. Imagine kombucha being made or beer being made, and those bubbles are created. Those bubbles are what happens in your small intestine because they're eating and fermenting on that food, and then they create that bloat and that gas. So a lot of people will even experience shortness of breath and pressure and tightness, and everything gets pushed around because there's always that bloat. The typical symptom as well that I hear is, I bloat. It doesn't matter what I eat. It could be, I could have pizza today and pizza tomorrow. Today I'll bloat, tomorrow I won't. That's because it doesn't have to do with the food. It's to do with how much fermentation is occurring in your gut. So that's a pretty typical sign as well if you've experienced that. And of course, there's other symptoms. You can have constipation or diarrhea. It could be alternating. It doesn't have to be one or the other. It depends what you've eaten that day. And then it's paired with brain fog and fatigue and concentration, because how can you focus when you are not eating your own food? The bacteria are eating those foods.
Let's talk about candida for just a second. If you are eating a lot of sugar, if you are constantly craving sugar, or you just love sugar, you're one of those people, you can't get enough, there is a good possibility that you have candida. But talk a little bit more about candida.
So when we think of candida, think yeast inside the body. So a yeast infection, you're seeing the yeast coming out. Candida is on the inside. So essentially it's an overgrowth of yeast, just like an overgrowth of bacteria. It's just a different type of pathogen. Candida is a bit more of a, well, it's a fungus, right? Think of fungus and how it spreads. So it can really take over the body. It can be in your joints. It can be in different organs. Like, it really can cause that heaviness and that pain in your body. And like you said, the sugar cravings are another symptom. Some people will get that white coating on their tongue and they can't seem to brush it off. That's usually called thrush. So it could be another sign of candida. And even itching in the rectum could be candida. It could be parasites, but it could be candida. And it's just basically opportunistic. So it's kind of like that uninvited guest that just takes over and spreads their suitcase all over your living room floor. So if you give it permission to live and take over, it will. So it has to be taken care of. And we'll talk a little bit about mycotoxins as well, which is mold, in the next few slides.
Yeah, and I want to say this because I think this is really important. First of all, I want you to tell your joke that you always say of how does someone know if they have parasites? So go ahead and tell.
Well, it's not my joke. I don't want to take credit, but I say it a lot. Okay, so everybody can go ahead and put their two fingers, index and ring finger, right on the right side of your right hand, under the thumb, under your right wrist, just under the thumb. You'll feel a pulse, hopefully. Do you feel a pulse? If you feel a pulse, you have a parasite. It's as simple as that.
And here's what happens. Like, a lot of people I've done that. And they're like, no, I don't think I have a parasite because I don't feel the pulse. And it's like, Yeah, you might not
I
feel
know.
it, but yeah, you do have a pulse.
So the joke comes from, if you look up on the CDC, the Center for Disease Control and the World Health Organization, their stats are, I think it's like 95% of people have parasites or more. And why that is because parasites and these pathogens, they're everywhere. It's a matter of how resilient your body is and how it can fight them off. And that's what we try to get to. It's not just kill parasites, it's how do we now become resilient to them so we don't continue acquiring them, because you can't avoid them 100%.
Well, and not only that, I think the biggest thing is that the biggest thing to remember is when it comes to candida and it comes to parasites, all of us have it. It's 100%. So 100%. It's just a matter of, has the candida overtaken your body? Has the parasites taken over your body to the point that you can't do anything? So do you want to expand on that a little bit?
Yeah, I have a bit of an example I use. So imagine you have an apartment building and the residents, we've got parasites, we have candida, we have SIBO, we have viruses, and you decide to do a treatment, a parasite treatment, and or SIBO treatment, and you focus solely on that. What happens is, let's say you are successful and you remove that SIBO from those apartments in the building. Now, all of the other residents are going to tell their friends, so other parasites, candida, are going to say, let's go, let's take over this apartment, we've got vacancy. And so then they take over those apartments. This is why you'll hear somebody say, I've done a SIBO protocol and it worked, but it came back, or I've done candida protocol and it's come back. We question, did it come back, or did we allow the opportunity for another opportunistic pathogen to take over? And now we're dealing with the result of that.
Yeah, so good. All right, let's switch over to mycotoxins and talk about those and how someone knows if they have it.
Yeah, so this is like one slide, and this can be talked about. The mold experts will say, you can't cover this in one slide. I just wanted to show it as a possibility in very chronic, complex conditions. So if you're somebody who has had these gut issues and these other autoimmune conditions and all kinds of things going on, and you just can't seem to put your finger on it, and you haven't tested for mold, specifically mycotoxins. Mycotoxins is the poison that mold makes. So if you've ever had water damage in your home, or if you've got water damage in your car, or and it doesn't have to be recent. This could have been 20 years ago. If you've ever had that exposure to mold or living in a basement, then you may have ingested these mycotoxins. Now, not everybody gets affected by mycotoxins. There's 25% of us that will, because we are lacking a gene that allows us to detox that effectively the second you remove the infestation. So let's say you have a moldy home, you leave, you should get better based on your 75% of the people that have the genes to do that. But there's a little 25% that you could have been exposed 20 years ago and it's still there, and you cannot clear it unless you have assistance to clear it. And so why I brought up this slide is because if we are working with parasites and all of these other infections, but you have mold has to be addressed first. There's contradicting information. My husband and I argue about this all the time because he had mycotoxins, parasites, heavy metals, like through the roof, so severe. And he had different experts helping him. And some of them said, deal with the mold first. Others said, deal with parasites. And so I think we deal with the mold first because it's so nasty. Like it can overtake the entire body. And it doesn't matter the best infection protocols you have, we have to get rid of the mold first. So I put that there because if that sounds familiar to you, you may want to do some mycotoxin urine testing that you can get online and order it to your home and do it yourself and get your own results.
So let's talk about people who have candida symptoms and possibly have candida and mold.
Yeah, and that's why I brought that up, because there's a lot of people will say, I did an allergy test, the scratch test, and I'm allergic to mold. That usually tells me you have mold mycotoxins in the system. So if you've had that allergy test done and it's positive, you might want to check for mycotoxins.
So let's talk about that test. So how does someone get that test done?
Yeah. There are two companies that I've used. There's Real Time Laboratories in the US, and there's also Mosaic, also known as Great Plains Laboratories. They changed their names. So they both have a mycotoxin urine test. And so you just get this test shipped to your house. You provide a urine sample, you ship it back, and they can detect the levels of mycotoxins. And there's different ones. It's not just the one mycotoxin. You have all the different species of this fungus.
And
and then
how
you get like a
accurate do you
report.
think those tests are?
I think it's pretty accurate. Like the people that I've sent, these are very sick people. And when they start to fix the mold, things start to become easier. Now the parasite protocols are working. Now they're actually starting to feel better. So with every test, my motto is always, if it tests negative, don't trust it if you still have symptoms. But if it tests positive, there's some truth in that. And I would still work with those results.
And I'm going to say this, if you go to a doctor, this is 100% true. If you go to a doctor, and we're going to literally show you pictures of people with massive parasites. And actually right here, I have a picture of, this is something I have at my house. You guys are going to think it's gross, but it's, and I'll put the link in for my Amazon link, but it's an XO strainer and it fits perfectly on the toilet. Like you can just sit it down and then you can poop. And then that way you can strain your poop. And we're going to talk about how to really analyze your poop and take a look at it to see if you have them. And I've literally at some point seen parasites, and in my stool, I took that in a stool test and they were like, no, you don't have parasites. So the ones that the GI doctors give you, it's literally 95 to 99% wrong. They'll tell you, nope, you don't have parasites. I promise you those are not right, not correct. We have a stool test that we will do that's more like at least 70% right. Wouldn't you say that's about accurate?
Yeah. I would say that these tests are not accurate, 100% accurate, because parasites are very stealthy. So parasites will they'll lay their eggs, and those eggs will hatch, and they come in cycles. And so if you catch them in the right cycle and you catch those eggs, it will come back positive. But if you didn't catch those eggs, you didn't catch them in that cycle, then you're not going to catch anything.
And they hide in the biofilm. So there's biofilm
yes.
in your gut. And
Yes.
so if you've got tons and tons of biofilm, the parasite. So for me personally, just so you know my story, from the age of 20 to 23, I was bulimic. For about two to 3 years, I was bulimic. And then after that, when I gave birth to my son, I threw up 6 times, not on purpose. I was just so sick, 6 times a day, every single day. So my stomach acid is probably worse than anybody on the block. And so those 2 products are absolutely essential for me to have at every single meal to make sure that my body is breaking down those. So let's go ahead and talk about some of the symptoms that you see when someone says, okay, how do I know if I have parasites? What are some of the signs and symptoms that you are seeing mostly?
Yeah. So depending on the infestation, depending on how bad it is, depending on how many you have, depending on how long this has been going for, they could be mild and they could be severe. And so abdominal pain, cramping is a typical one that I see a lot. It doesn't have to mean it's every day. It could mean when you've consumed a lot of sugar that day, or you have a lot of stress, and all of a sudden you go into this like abdominal cramping that's relieved by having a bowel movement. And prior to seeing that parasite, that's exactly what I was getting. And I'd eat something. Even it was gluten at the time, because I was eating a little bit of gluten, and I was eating a little bit of dairy, and I was cheating a little bit here and there. And if I had even just a little bit, I'd go into this full blown reaction thinking it was just gluten reaction. But then when that parasite released, if I did touch a little bit of gluten, I didn't have those reactions. So I realized quickly that those abdominal cramps that are pretty severe and intense, that could be large tapeworms. Another symptom is a non-popular one, but it's an itchy rectum, like an itchy bum inside the hole. So if you notice it's itchy, especially at night, because parasites are more active at night and they create more restless legs, more restlessness, this could also be a sign of parasites. The itchy bum could also be low stomach acid. It could also be vitamin A deficiency, hemorrhoids, of course. But if you ruled those things out, it's maybe parasites. And then there's also the grinding of the teeth. You might even see this in pets and dogs as well, where you're clenching your jaw or grinding your teeth. That's also another a typical sign of parasites. And then you have the obvious gastrointestinal ones, so the bloating and the diarrhea and the constipation, like that can really come with SIBO and Candida. Like those are all typical, but what makes parasites a little different is those atypical ones. I also see mood disorders. I always remember a case I had of a bipolar case. It was shortly after I had done my coffee enemas and I released this tapeworm, and I came out so excited. I wanted to give everybody these coffee enemas. And this woman came to me with bipolar disease. She's had it in her entire life in her testimony. And we decided to do coffee enemas along with a parasite protocol that I'd done before that. And then she said within 3 enemas, she started to notice her anxiety or her depression had left, and she was just left with anxiety. And she thought, oh, maybe it's a coincidence. Maybe my manic, I'm still cleaning. I'm still in my manic phase, but I'm definitely not depressed. That's lifted. We waited 2 months. It still never came back. And she just kept doing these coffee enemas to release these parasites. And to this day, she said it's never come back. And her manic, she realized that's just me and my OCD tendencies. So that's a really awesome case that I've had. So really they can come in all different kinds of ways. It can come in the skin. I had a child last week with a really massive skin infection that started with just a little rash that looked like eczema. Doctor diagnosed it with eczema, put cortisone cream on it because that's what you do. And then after about a week, it turned into a full-blown parasitic infection all over her body, itchy and so painful, and nothing was fixing it anymore. And we have to go into an anti-parasitic protocol, even though her stool test came back negative, because then she went to an infectious disease specialist who finally diagnosed it with parasite. So it was a little too late. That could have been addressed by properly identifying parasites at the beginning. So there's so many different things. I mean, parasites can infest every single part of your body. Parasites can enter into your liver, and so these are called liver flukes, and we'll look at them later.
So I'm going to warn everyone right now, I'm getting ready to share my screen. Yeah. And if you have a weak stomach, then you might want to just close your eyes for just a second. But we're literally going to show you real parasites. And like I said, back to what I said, one of the biggest things that you can do is buy something like this. I put the Amazon link. I'll put the Amazon link in the notes, but all you do is you can take it, you should be pooping, and then you can put it in here, and then you're going to dissect your poop. We're going to talk about that in just a second. So let's take a look at the first one, which is roundworms.
Yeah. So these are actual pictures of my patients with their permission. And so these roundworms are, they can look like big biofilm, but when you pull them apart, they are staying sturdy. And the thing is if you're having a bowel movement and it's going in the bottom of the toilet, you're not seeing these because they're just getting mixed up in the poop. Whereas if you have a strainer, you're doing coffee enemas, or you even just collecting it like Chantel is suggesting, you're able to pull this apart and dissect the stools to be able to pull these out. So these are, so just roundworms that can come from meats, from other food sources. And really, like, I'm not a pathologist. I can't sit there and go, well, this is this kind of roundworm, and this is this kind of hookworm. It's more like, these are not normal. These are parasites. This is not coming out in people. Like, look at that. That is like, that is intense. And this actually was after a round of ivermectin for this girl. Her doctor was on board and prescribed to her some ivermectin with us. And then other ones that come out, this is a debatable one. Is this an actual worm, or is this a byproduct of intestinal tissue? Regardless, it shouldn't be there. And if you have that, it's because you've had parasites that have made enough biofilm that have now solidified this biofilm into intestinal tissue and lining, and this is coming out. So that's one theory. And another theory is that it's an actual worm or bunch of worms mashed up together and making this like ropey looking appearance. And you can tell it's a ropeworm because when you put your like plastic fork through it, if you're fishing through, it doesn't mush like stool. It's hard. You can't penetrate, you can't get through it. And that is my rule of thumb. If you can smush it, if there's something that looks like food and you're not sure, if you can smush it, it's likely food. If you touch it and it's a bit harder, it's not food. It might be a parasite egg, or it might be an actual worm. So they're not easily broken, these parasites. Now, this is my son's diaper when he was 2. And so you can see the little thread worms. We've been dealing with parasites in our family for a while. And he at the time he was a very picky eater. He was bloated once in a while, and he was very moody, very emotional. And he would hit. He was a hitter. And so I always say with children, we want to look at the physiology before we blame the behavior. What is going on in their physical body before we start addressing the behavior, right? Because it could be a physical problem.
This one right here, this one's thread worms as well. But now we're going to get to the big ones, which is the tapeworms. So these are the big daddies. So let's talk about these.
Yes. So this is mine, actually. So this is day 1 after 1 enema. And I had been doing a parasite protocol already because I was just aware of parasites. I knew I had just gone to Hawaii, and we were at a luau, we had pork, and I was just being cautious, and I put myself on a little parasite protocol. And I did get symptoms of cramping and some diarrhea. I assumed I ate something off, didn't assume it was food poisoning, but in case it was, I decided to do it. And then my husband wanted to do coffee enemas because he thought they were cool and they had a lot of good things that can come from it. And I thought he was crazy. And I even had the mentality as a naturopath trained that parasites were not a thing here. Many of my colleagues will still believe that. Like they will look at this and go, there's no way, this is impossible. This is because you've traveled. And so this is not an acceptable thing in the medical community. Like it's for a lot of people, they're still wrapping their heads around this. So when this came out of me after my husband, who's a pilot and had traveled the world, was trying to convince me that he had parasites, and I was blaming it on mold and heavy metals. And I said, no, it's not. He did this coffee enema. We both did it. And out comes this. In total, we measured 7 feet. So this is like day 1 and then day 2. And bless his heart, he was the one pulling them out for me because I did not have the stomach at the time. But yeah, this is how quickly they can grow. And I had read at the time, this is impossible. How could this be the luau? But they can grow up to 25 feet in 2 months. So this is pretty. And at the time, I was not losing weight. People would have assumed I was getting really skinny. I was actually gaining weight. And I understand now why. It's because they're depleting you of all of your nutrients. So you're hungry. You're always hungry. Nothing seems to be satiating you. And so your body is trying to find these nutrients and you're constantly trying to eat to satisfy this tapeworm. So it's actually having a bit of an opposite effect on me.
Well, let's talk about the stool test because tonight we're going to give you a chance, or today we're going to give you a chance to get one of these stool tests. And like I said, I believe that the ones that we are going to do are about 70 to 80% effective of finding out exactly what you have going on. So we're going to see some of the samples of what it's going to show you and what these tests, it's kind of like an overview of them. So do you want to go over that?
Yes, for sure. So I was just answering a message in the chat. So this is a GI map. Now, again, the GI map is not 100% accurate. What we're trying to do, what I do before putting or suggesting this test is I'll have people do something like N-acetylcysteine, NAC. NAC is a phase 1 biofilm disruptor. And so it helps to chip away at that biofilm. Phase 1 meaning a mild biofilm, and there's more intense biofilm busters that are in phase 2. So I'll have people start a NAC for a couple of weeks to start working at that biofilm so I could potentially release any parasites that are hiding behind a biofilm. Then once they've done that, they'll do this test. And I try to get them to do it on a full moon. During the full moon, parasites are just more active. If you think of how the moon can influence the oceans and the waves and how surfers rely on the moon, it's the same idea in our body. Our bodies are dictated by the moon as well, and parasites are more active, meaning they lay their eggs or the eggs hatch around full moons. So that first page, Chantel, that you had up, that first page is the really severe infection. So we see things like E. coli on there, Cryptosporidium, back up a little, yeah, that one, Campylobacter, Shigella, Salmonella. So they've placed this all on the first page because these are severe infections that if you get, public health is usually calling you to find out where did you get this from, what restaurant did you eat at, so that we can make sure that it's not going to create infestation in other people. And then the second page goes into H. pylori. So H. pylori can be tested through breath tests. and blood. Blood is useless because blood only tells you whether or not you've had the infection, but is not telling you if you have an acute infection, like a current present infection. Breath test is about 70% accurate, so it can also help to detect it. But many doctors don't want to send you for the breath test, and so you're left with these symptoms. So this stool test picks up on H. pylori and the DNA of whether or not you have it. So this particular test, you can see it's, sorry, go back to the other slide, Chantel, for a sec. Because in the bottom one, you can see the probiotics. So like the good bacteria. It's called the commensal bacteria. It's under H. pylori. So the next one. Yeah. So right there, commensal bacteria. So this test is also telling you, well, do I need a probiotic? How are my good bacteria in there? So do I have an infection, or am I just lacking the good guys, which is making me have symptoms? And then the next page is the opportunistic. This is the overgrowth. And so a typical SIBO test, you might have heard of these. These are SIBO breath tests. They're hydrogen breath tests, and they measure the actual gases that these bacteria are producing. And the report says, yes, no, I have SIBO or I don't. I don't use those tests. I don't find them to be that useful. I prefer doing this sort of test because now I get to see the actual bacteria in there. And if, as you can see, there's a bunch of red in the opportunistic and the particular kinds, you can deduce from the symptoms and from that it is SIBO. You don't need a breath test to diagnose SIBO. And then you also get other bacteria too, like you get the inflammatory and autoimmune bacteria, which will tell you if you're susceptible to autoimmune disease. It doesn't say you're going to get it. It says, ooh, you have this bacteria and you might be at risk now because it's an overgrowth. So it gets us to target those bacteria more aggressively. And then you saw the candida underneath that as well. So fungus. On the last page, Chantel, if you do see candida as high, that might give me a clue. So you see the different funguses, candida, geotrichum, microsporidium. Those are all different types of molds, funguses, basically. And so if you have those elevated, then I'd send you to do a mold test because that might be a mold issue. And then you got a couple of viruses, the EBV. They're not the most accurate in all honesty, but I've had one person that came back positive and it was really helpful for us. And then the next page shows the actual parasites. So you've got the protozoa, which are little ones that you can't see only under the microscope. And then you've got the worms, the ones that are more visible. If those come back negative, which a lot of times it does because of what I mentioned before about the inaccuracies with will they come out? You have the bottom, the intestinal health markers that tell us and suggest whether or not there still could be an infection. So for example, they're testing whether or not you're breaking down fat. If you've got a lot of fat in your stool, that's that steatocrit. If you've got a lot of fat in your stool, then that means there's a chance that those ducts that release the bile acid to break down fat are getting blocked by a parasite or biofilm. Elastase is a marker for the pancreas, but can also indicate low stomach acid. So again, if that's low, it indicates that you're probably susceptible to getting parasites. And then you have the blood in the stool. Blood in the stool can mean, yes, hemorrhoids and fissures, but it can also mean parasites as well. You have beta-glucuronidase, which is a marker to know if we're properly detoxing estrogen. So it tells us how well our liver is doing. And then my favorite one is the secretory IgA. This stands for immunoglobulin A. Immunoglobulin A, IgA, is a marker of the antibodies that reside on your mucous membrane. So if you've got that very elevated, then that's telling me the immune system seeing something. What's it seeing? Even though all of these other things are coming back negative, the parasites, the bacteria, your immune system is pissed off, for lack of a better word. So why is that? And that gives us a clue that there still could be parasites. We also have a gluten marker in there, whether or not you're sensitive to gluten. It does not diagnose celiac, but if you're intolerant to gluten. And then this eosinophil activation protein, if it's elevated, that is an indication that you have a parasite. And this is also in the blood test. There's blood tests when you do a CBC, it's a complete blood count. Like you'll look at hemoglobin and all these different markers. Eosinophil, if it's elevated, can mean either an allergy or it can mean a parasite. And then calprotectin, a lot of people don't know they might have an irritable bowel disease. So Crohn's, colitis, microcytic colitis, and it's found only later when they start to bleed. So it's a really nice way of interpreting whether or not you already have inflammation. It's an inflammatory marker specifically for the gut. And so if it's elevated and very elevated, I've sent a lot of people to get a colonoscopy after that, and they've been diagnosed with Crohn's or colitis, which, by the way, I consider as an autoimmune disease, likely caused by a parasite or another infection that was just not addressed. And then last but not least is the zonulin. Zonulin is a marker of leaky gut. So if your zonulin is really high, it leads us to believe you have leaky gut, which is why you're reacting to all the foods and all of that. And then these are just things they add at the end. So let's say you do test positive for H. pylori, then they test whether or not you would react well to an antibiotic. That is the conventional method to treat H. pylori. So you don't have to take the antibiotic, but if you wanted to, it tells you if that H. pylori strain is resistant to the antibiotics. And these antibiotic resistance genes are for, in general, are you generally resistant to antibiotics? And it would be a bad idea to use them for SIBO, for example. So yeah, that test is really heavy. There's a lot of information in it. But I really like, it really gives us a lot of information and it guides us in the right direction. Even though it's not completely accurate, it gives me so much information to guide us. So,
Yeah.
yeah.
So let's give them some tips on digestion for just a second. And I want you to talk about the test for low stomach acid so that we have a baking soda test. So talk about that, of how you can actually see if you do have low stomach acid.
So the baking soda test is really simple. It's cheap. It's not, again, 100% accurate, but it can definitely lead us into questioning and really identifying if you have low stomach acid. So it's get a brand new box of baking soda, because baking soda is highly absorbent. So if it's been open, it's going to absorb toxins in the air, mycotoxins, and you don't want to ingest that. So get a brand new box of baking soda. You're doing a 1/4 teaspoon in about a 1/2 cup of water. And you're going to drink that in one shot, and you should burp within 1 to 3 minutes. Anything more than that, any longer than that, indicates you don't have enough stomach acid. And that's because the baking soda and the acid should react, and it should create bubbles, and you should burp pretty quickly if you have enough stomach acid. But if it's not, and it's very delayed or non-existent in some cases, then you have really low stomach acid. So that's a pretty easy one you can do. And you can do the one, Chantel, that you have, your HCl pills. It's called the HCl betaine hydrochloric acid test. So you're taking, you're buying an HCl bottle. It's HCl. HCl stands for hydrochloric acid, which is stomach acid. And the idea is, if you take a pill in the middle of your meal and you don't react and you have no reaction, then you likely need it, because if you did have enough stomach acid and you took stomach acid, your body would hate that, and you'll have a lot of heartburn or discomfort or pain. For a person, I want to caution you though, if you're a person that suspects an ulcer, or if you suspect a lot of irritation, you don't want to be doing hydrochloric acid, and you'll know from that first pill, like it'll be awful, and you don't want to ever do that. And if you even consider, if you even think you might have it, I wouldn't even try that test. I would just do the baking soda test, because you don't want to create any irritation in that esophageal lining.
That's true.
Yeah.
Well, one thing that I have the most trouble with is chewing my food 31 to 33 times. I'm like the fastest eater in the world. And I will say the one thing I've really done a good job of is I don't have any water at my meals. And I literally, this is what I do. I let them fill up my water. Sometimes I don't fill it up at all, but I let them fill it up here. And then they always try to refill it. And then I just go like this. Or I just say, no, thank you, no water for me. I don't like to drink with my meals because it dilutes my stomach acid. I'd rather not have any water. That's the best method, because even if that little bit's there, I end up drinking it, and then I look away or I go to the bathroom and they've refilled my glass. So the best method is just get yourself in the habit of not drinking any water with your meals. And I feel like you just keep working your way up. And I would say now I probably drink about this much water with my meals, but I really want to get to the place where I'm not drinking any at all. So give us some more digestion tips. What about lemon water?
Yeah, I really like lemon, especially if you're trying to be cheap and not wanting to spend a lot of money. You can use food. So I will often use lemon water, but specifically with the rind of the lemon. So you want to grate it. My tip is, this is what I do at home. I will have a mason jar, and once a week I'll grate my lemons, about 3 or 4 of them, and then I'll also cut them, squeeze them out, and then I'll sometimes leave them in the jar, but I feel like it lasts longer if I don't, so I'll pull them out, and then I put a little bit of water in it, and that becomes my lemon juice concentrate. So then every day I'll be able to splash that lemon juice in my water, so I don't have to do that every single day. And then the lemon rinds, which are really bitter, can sit there and infuse the water, and that's what stimulates your liver to help make the bile acid and help with detoxing. And then that jar usually lasts about a week, 8 days at the most in the fridge. So I like to use that, but I drink with a straw because it can damage the enamel of the teeth if you're not drinking with a straw. So I like that. I also suggest milk thistle tea because milk thistle also helps with your liver. So those are a couple of home tips. And Chantal, if you
And I want to talk about uncooked
yeah.
foods. So a lot
Yes.
of people are like, oh, let me just have like raw kale salad and raw this and raw carrots. And I will say, if you're on this call, there's probably a good chance that you've got a gut infection. And the problem with uncooked foods are they're generally more difficult to break down and digest. So if you've got a gut infection, you probably have a lack of enzymes and a lack of good bacteria. And both of those are so necessary to break down raw foods. So for a season and for a time, especially if you go into the bathroom and you see all these, like for me, that was a big problem. I would look in my poop and it was like, oh my gosh, I saw all this undigested food particles sitting in my poop, which means that undigested food particles were sitting in my digestive tract. So that is another piece that you might just say for a little while and for a season, I'm going to go ahead and I'm going to cook my food and I'm not going to do raw food because it is really harder for you to digest. Let's talk about probiotics and prebiotics for just a second.
Mm-hmm. Yeah. That is such a misconception too. So what I do with probiotics, I'll have you take a probiotic as a test. If you respond well, meaning you don't have more bloating, excess gas, and it's not making you uncomfortable, and you might actually start to feel better, then that probiotic means you probably need that probiotic. This is assuming you've not done the GI stool test and you just want to try a probiotic. If you react negatively though, if you get bloating, if you get gas, if you don't feel well on the probiotic, it's likely that you have an overgrowth. So it's a sure sign that it's small intestinal bacterial overgrowth. Because when you're in an overgrowth, it doesn't matter if it's good or bad, you're in an overgrowth. You throw in any other bacteria, even though they're probiotics and they're good, the body rejects that and it's too much and you get that bloat. Now, there is this moment about a week's time where there's a bit of a battle happening with the good and the bad, and it can create a little bit of bloat and gas, but that should wear off. If that does not wear off, then that means it's not good time to take probiotics, and probiotics are best later on in the protocol after we've killed off the overgrowth of the pathogens of the intestinal bacterial overgrowth. When it comes to prebiotics, it's the same idea. Prebiotics are highly fermentable. This is why they work so well at feeding the good bacteria. But if you're in overgrowth and you give them their food, those bacteria eat the food, the bad bacteria, the opportunistic, not the good. And so those prebiotics like kimchi and sauerkraut and kombucha, and you're thinking you're doing all this amazing stuff, but it makes you feel worse, is because you're feeding the bad guys. And so until you've removed those from the intestines, it's not the right time to throw in those prebiotics. You again throw those in later in the protocol once we've eliminated most of them.
So we're going to talk about a parasite cleanse and doing it on your own. I want you to talk about the die-off because this is really, really important. I know for me personally, I tried to do some things on my own, and the problem is that killing those parasites, if you go too intense on it, the die-off is so bad, then you feel 10 times worse. And now you're like, forget this. I rather, I felt better over here with the parasites than trying to kill them. You're literally like on the floor. You're feeling so bad. So talk about that die-off reaction.
Yeah. So what can happen is, let's say we're talking about a parasite. Parasites and heavy metals go hand in hand. Heavy metals is like a food to parasites. And so when you're killing parasites, when you're killing bacteria, they open up, right? They die. So all their contents spill into you. And now your body has to manage eliminating that. And so if your system's not ready for that, if your liver is not moving properly, so bile acid's not properly flowing, if your intestines aren't properly moving and you're slightly constipated, if your kidneys aren't flowing and removing water soluble toxins, like if your munctaries, we call these elimination organs, aren't properly moving, then these things get stuck in the body because the body panics and goes, I don't know what to do with this. She's going to be sick, or he or she's going to be sick. I'm going to shove this in some fat cells, or I'm going to shove this back into the liver. And then your liver and your body has to do this massive, it's like a reinfestation, a reinfection. And so you have symptoms of headache, you have symptoms of fatigue, and you really feel like crap, for lack of a better word. And so it's dangerous, because if it is heavy metals, for example, let's say you do a coffee enema. Coffee enemas can really release a lot of contents, and they can dump heavy metals into the intestines and other toxins. If you do that and your body's not ready for that, and you don't have the binders and the sponges to grab that and eliminate them through the bowels, then that has to get circulated back into the body. There's no other way that the body
I
can do
cannot
that.
stress this enough, you guys, because if you think about it, if your drainage pathways are not where they need to be, then you're killing all this stuff. And I promise you, you're going to feel worse. So you have to be on the right protocol, because if you don't, you're going to be like, I'm feeling worse. And that's the last thing that we want. Christal, what else did you want to let people know about that we didn't discuss already?
I think what's important to understand is, so in those courses that we're talking about, we're not just dealing with parasites. A lot of overlap occurs when we're treating infections. And so I've come to this conclusion in my practice that I would say about 80% of the people can't sometimes do the testing for whatever reason. And we still can treat infections because a lot of herbs overlap. And coffee enemas, somebody asked in the chat what coffee enemas are. Coffee enemas is something we will throw in afterwards. So I don't usually start with coffee enemas. We do the protocol. I do have a coffee enema course that if after this 4-week course you want to try the coffee enemas, it's like a $60 course or something like that. It's nothing too crazy. It's just to teach you how to do the enemas and what you're looking at in your poops. And what it does is it facilitates the elimination. So coffee enemas will actually dilate the bile ducts so that there could be elimination of the film, the biofilm or sludge or whatever is accumulating in these ducts, even stones, and it dilates those ducts to be able to dump that into the intestines and eliminate this. But this is why you have to be on a protocol first, because you don't want to dump all of that in the intestines and then have nothing to grab it and pull it out. And so they're done at home. They're easy to do. It's not expensive. It's like $40 or $30 to buy the actual kit. So it's a really nice at-home method that you can use. And actually, Chantel and I recorded on our podcast. If you check out our podcast, there's a podcast specifically on enemas that you can listen to a little bit more detail if you want. But I guess the take-home message is gut infections. When you have one, you have another. It's very rare that I have somebody that just has SIBO, because these are opportunistic bacteria, parasites, funguses, and this is why it can get complicated. So gut infection protocols, parasite protocols, for me, it's all the same. I work with all of it. And if we get snagged somewhere, let's say you're trying to take supplements and it doesn't work, we get snagged, then it might be because you have H. pylori, because you're not able to break down the supplements. And that's what's holding you back. And so there is a process to this. And then the stool tests obviously help with guidance.
Yeah.